So, good afternoon. I'm Ed Baker, and I am very thrilled to be with my good friend and colleague Dave Ross to talk about leadership. And today he's going to be sharing with us a number of his perspectives and experiences. Dave currently serves as the CEO and president of the Task Force for Global Health in Atlanta. Prior to that, he directed the Public Health Informatics Institute. We'll talk about that a little bit today at the task force. He and I worked together at CDC a few years back, and he's done an enormous number of leadership things in the health system that we want to talk about today. So, Dave, thank you so much for joining me.
Hey, Ed, it's great to be with you. Thanks for asking me to join you.
Great. Well, we're going to proceed here and go through a few questions. First of all, what were some of your early formative experiences that have really contributed to your style and development as a leader subsequently?
Two big things pop out. One is understanding who you're attempting to lead, who is your audience. And I drew on my background. I grew up in the country, and as a ranch kid, I learned if you want to get the animals, the horses out of the pasture, you don't chase them. You help draw them to some sweet hay. And so early in my career, I had the epiphany that in some ways, many humans resemble herd animals. So understanding how to get the herd to move with you. I mean, as we all know, leadership requires followership. And so that experience I came to learn over time was really very, very helpful, because if you do view people, particularly in the government context, as the herd, they seek security. And if you chase after them like a predator, they run. So if you draw them towards you, you can get them to stick their neck out and come your way. So it's clear that in the governmental context, my experience at least has been in government situations, risk-taking is often greeted with punishment, while going along to get along is often quite the right thing to do. And so following the herd, whether it's going the right direction or wrong, is rarely punished. So anyway, my takeaway from this, first takeaway to answer your question, is know your audience, know who you're working with. And I guess the second part of that is knowing your context. My time in the military taught me a lot about that, in the military context, it's very clear, it's a command and control environment. But in a command and control environment in the military of these days, it's not just top down all the time. The top sets the strategy, but it's the people at the ground level who now have the flexibility to develop the tactics that will work. So one of the things I learned in that situation in military was differentiating between tactical leadership and strategic leadership. And know when and how to involve those that can help you shape strategy versus those that really should help set tactics. If you involve the tactically minded, tactically acting and thinking people to set strategy, you're probably gonna have problems. You may be going in the wrong direction. But conversely, you can set all the strategy you want, but if the people who have to, actually act upon it and take practical day-to-day actions don't have the flexibility to be tactically smart, then you also will fail. So the military taught me a lot about differentiating those two. And then finally, I think my time at CDC taught me a lot about public health, and I created a lot of that to you. But public health is a federated team sport, period, in the US. It's the responsibility legally of the state and local agencies, varies of course by state. But that's really, really important to understand who can act independently And this is, really quite demonstrated during COVID, where health agencies make recommendations, but the actual implementation of the risk management is the political authority. And they don't necessarily do what we tell them to do. So again, it sort of comes back to knowing how to mold the groups of people to come in the direction you want them to come in. I've worked in the private nonprofit, in the private for-profit sector, and it's very different. There, it's eat or be eaten. And there, it doesn't matter who you punish as long as you're profitable. Very different context. And so understanding your context, who you're working with, what their motivations and drivers are is really critical.
Let me build on that if I could, Dave, and sort of segue into role models. You've listed a number of different areas that you worked in over your career. Who have been some role models that you've really benefited from, and how have they influenced you?
In my educational experiences, therefore being very young, I had a professor in my graduate aero systems engineering, Dr. Josh Menkes, really influenced me. And then at Hopkins, Dr. Charlie Flagel. Both of those two really helped me see that systems thinking can be applied to healthcare and public health. And I like it, for better or worse, I accepted a long time ago that I'm a sort of a higher level systems thinking type person. That's where I am. Some people do that. Some people are really good at the detail. I'd probably met a terrible neurosurgeon. Just the detail of it would bore me. Also at Hopkins, Dr. Abe Lilienfeld, who was chair of the EPI department, and then later Dr. Bill Faggy, who used to be director of CDC, I think as most people know, they inspired me to value the power of population level interventions as a way of doing good for mankind. That idea that you can do things that affect the health of whole populations of people just totally grabbed me. And then you, when I worked with you at CDC, you sold the INPHO vision, the idea that public health could take a step forward and improve its ability to gather and manage and use data and turn it into information. And you helped me also see how public health in this country actually worked. I came to CDC as a researcher from Hopkins, thinking in a research mindset, doing environmental health, chronic disease research, and really viewed the state and local agencies as people who give us data. And that's a big mistake. That's not what public health's about. It's not how it works. And you really helped me see how it works. And also you did something that nobody else was doing at the time, really, which was package a vision and sell it, and actively go around and try to lay out the vision and help people see this is where we could be going. Do you agree? Isn't this worth headed in this direction? And that was also quite inspiring. So thanks for that.
Thank you for your kind words. And it's wonderful remembering those days when we did work together on that project called INPHO. And for our audience, that's an acronym, the Information Network for Public Health Officials. And we'll get into informatics a little bit more in just a moment as Dave and I talk. But what about those role models? You've listed some people. What attributes were important in determining their leadership effectiveness? In other words, when you think about them, what did they do that made them effective leaders?
Yeah. Well, I think first and foremost, they inspired and gave others confidence to step forward. And again, as I go back to my herd metaphor, you want to show some nice tasting hay to get the herd to kind of walk over and taste it. And sometimes you have to, embellish that with some words, some actions, some visions, but you got to give people confidence to come forward. At Hopkins, as a student, we had monthly seminars that we periodically, as students, have to lead. That was a great learning lab. As I mentioned, Dr. Josh Menkes, he had actually been a senior appointee in the Kennedy administration. And he taught us to think big and small at the same time as a systems thinker. And it was really mind expanding, the things he had us work on. And I just learned so much, but it gave me confidence that, wow, I can think big and I can think narrow, and that you're going to have to be able to think that way. I think with Bill Fege, he showed that the collaborative coalition approach actually works. And, as we had worked on the information network for public health officials, one of the things became very clear was you can't just tell state and local public health agencies what to do. They have their own authority to do what they want to do, and they have their own realities about what they can do. And so if you really want to get people to forge and come together and come to a higher level of practice and maybe involving a new direction or new capabilities, they're going to have to be convinced. And one thing that Bill Fege demonstrated was you actually can solve big problems by accepting that many people are involved in the solution of those big problems. So helping them to develop awareness and building skills to come together as a coalition is really important. And in fact, my organization, the Task Force for Global Health, is really built largely on those propositions. And that's a discussion for another time, but it's really, really important. And then I think you showed both approachability and humility and humor in drawing people in to listen to the vision, to get inspired to say, yeah, okay, we probably can do some things differently. And all the different pieces of the public health practice office that you ran at the time at CDC really made big contributions, particularly in the training area. The public health training network, that was hugely popular and helpful to state and local agencies. So it elevated practice. And what we did with the INPHO was a first step among many that are right now. We're in the data, what's it called? The Data Modernization Initiative, the latest round of new funding to try to up the game for public health. But it all comes back to the same challenges of giving people a vision and being able to draw them to that vision. And so your skills at being able to do that made it possible for us to take steps forward. So that's those are key things I would look at.
Well, thank you again. And that kind of leads me to the question about how those experiences and influences then shape your approach to the practice of leadership. What are your guiding principles? You've touched on this some already, Dave, I know. How do you translate these principles into action and really employ this on a day-to-day basis? It's the day-to-day basis that I'm really interested in.
Yeah. Well, in talking here about the public health context, I've led in the private for-profit sector, and some of those lessons learned are the same, but to some degree they're different. But when you think about public health, it's a public service. So it's essentially the herd following the directions set by their leader. And the leaders, though, are the legislatively elected people, the elected officials, not necessarily those of us who do the work. We would often like to be the ones who direct and dictate strategy. But in fact, it's what the legislative bodies give us money to do that tells us what we can do. So it comes back to sort of getting the herd to follow you. You don't chase them, but rather you cajole them with good ideas and tweak their curiosity, and you avoid threatening them. And that old African proverb, to go fast, go alone, to go far, go together, totally applies to the work of public health as far as I'm concerned. The herd will only go as fast as you can get them to come with you. If you get too far ahead, as I've said to people often, if you get a couple of hills ahead of the herd and they lose sight of you, it's over. They're not following you. They're going to find a new leader. So you got to keep the herd with you. And that means that they don't necessarily go fast. but they can be led to go far by staying together. And so you sometimes have to accept that it's at a glacial pace. And that's very frustrating for people like me. So another lesson is really about your own honesty and integrity. That has to be the calling card in our business. This requires that you be kind and respectful of everyone, because you got to show people that they deserve dignity, and you've got to dignify them. And if you do that and you sit in conversation with them, that's the starting point. I often chuckle when people tell me they've got a good relationship with somebody, and I ask them, well, what kind of relationship? And they say, it's a good one. I said, oh, well, tell me about the person. You know, does he or she have a spouse, have any kids? And they say, I don't know. What can you tell me about them? I can't tell you anything about them. Oh, well, that's not much of a relationship, is it? Have you ever bothered to sit down and just try to talk to them, get to know you? That's important. Another lesson, sort of in military service, taught me not to ask the troops to do something that I won't do. So if somebody really needs to get some help, you've got to be willing to roll up your sleeves and help out, presuming you know how to help out. But you can't necessarily do everything. But you really have to be clear with people that you're willing to try to help them do what you want them to do. And I think the last lesson is about this relationships. Public health's a relationship business. At the heart of it, think about it, the best local health departments are ones that are known by the citizens in the community, where the health department people know the key leaders of the community. As we got to know well after the 9/11 catastrophe and anthrax episode, it became common in sort of teaching about public health response to say, you know, the emergency is not the time to be handing out your business card. That means get out and know the people, be known by them well in advance, have a relationship. And if you have those strong relationships, they're more likely to trust you. But at the time of extreme circumstance, and you have to go introduce yourself, you should be honest and say, why would they trust me? Just because I've got a set of initials behind my name? They don't know me from Adam. So you've got to be known. And I think that applies both in how we practice public health in this country, but it applies just to leadership generally. We are a relationship business.
And you know, those guiding principles and the practices that you just mentioned so capture your leadership style, as well as the way I've seen you in action. So let me ask a slightly different question. You've touched on the work you've done in different places, both at the task force and the INPHO project and in other ways. Talk about how you select people to be on your leadership team within the organizations or teams that you've led. What do you, how do you go about doing that?
Certainly, do they have a record of respecting others? That matters a lot. What do other people say about this person? I know a lot of very smart people who have a history of running over other people, and those are not the people I want on my team, because yeah, they may be smart, but they're not going to enlist other people to join the march in a given direction. I want people who have the ability to sell ideas to others, and not just dictate it, but to be able to actually try to convince other people and be clear about what it is this new direction we need to take is, and why do they need to follow us. You want clear thinkers, and you've got to be clear, am I looking for somebody who's filling a strategic thinking role or a tactical thinking role, or both? So tease out those abilities. Of course, content in our world matters a lot. I mean, do they have the expertise that matters? But notice, to me, that's coming down the list a bit, because I've known too many really highly educated, really smart people who just, it isn't their forte. They're technically smart, but not able to bring others along with them. So if you want to have people that help lead an organization, the people being led have to want to follow. And that means finally that they have to be able to build relationships, and the types of relationships that propel progress.
Those attributes are so key, and thank you for going through particularly in the way you talked about it. Let me shift over, if I could, Dave, to the public health informatics area. We've
Mhm.
talked already about your pioneering role in that field. You have been a pioneering leader in public health informatics for decades, literally. You've served as a leader in various capacities. Could you describe some of your experiences and particularly what are you proudest of and why?
Well, first, let's be clear. Informatics is an intermediary discipline. It's a way to help achieve an end in public health that matters. So like immunizing people is a goal in public health. Well, that requires a number of things, including information about what the people have already, immunizations they've had. It requires a whole lot of information, but the information in and of itself is not the end. So you've got to, if you're going to be in informatics, you really have to understand that we are facilitating progress. And therefore, you've got to be helping people with your tools and your information. Again, it comes back to then who are you helping and what's their context, and are they able to take your help? You can push all sorts of fancy stuff onto people, but if they can't use it, then you've wasted their time and your money. So understanding that is absolutely critical. Also, public health people, I've learned, care about the end outcome. They don't care that much about things like efficiency. And so if the information tools that we bring to them are largely about information, that's a harder sell than if it's tools that help them have bigger impact. And so relating that tool to the impact is really a critical part of being successful in informatics, I've discovered. It took me a while to get there because I thought it was common sense. Like, oh, look at this. Look what we can do. We can analyze these data better if we do the following thing. Thinking everybody's going to say, oh, well, that's marvelous, I'll just grab onto that. Well, that's not how that works at all. Or saying that, wow, we could be so much more efficient if we modernized our processes. If you don't relate that to how that's going to make them more impactful, then, and be very explicit about it. That's another sort of lesson I've learned, is that if I can't be explicit about how this thing called informatics is going to help you, the public health practitioner, achieve your health goals better, you're going to lose. It's just more stuff being thrown at them. They don't want to know. I think in the case of what I'm happy about, I think with the INPHO initiative, we at least showed to the public health world the promise of technologies and set the groundwork for what did come. We were right at the leading edge of this thing called the internet and the wide world web opening up for everybody, and the blossoming of our personal medical information being digitized and made more useful to your practitioner as well as maybe for population purposes. All of that, we were sort of on the leading edge of helping people see what was coming. With the Informatics Institute, what we understood there very well was that we had to come to a value proposition that was going to be useful to public health practitioners. Initially, it was just for the US, and then ultimately it's blossomed around the world. But to be useful, that meant that we had to help them see how the work they did was in common with their colleagues, that they weren't all that different. And so I'm proud of saying to people often, you're special, but you're not that different. We all do the same work and we mostly do it the same way. And therefore, let's get together and come up with better tools. Let's make smarter investments so that our information actually becomes powerful agents for health improvement. And I think one other thing I'm really perversely proud of is I've been able to stop some really bad expenditures. in the name of technology. One was in a country on another continent, far, far away, but we were working in this country, and they had a lot of money being thrown at them, and they wanted to automate their national health system, sort of in the image of the leading edge of American hospitals that were at the time, this is 10 years ago, implementing electronic medical record systems. But in a country where maybe 1% of all people got care in a hospital. And I laid it out for them and said, look, if we start with the proposition that how do we apply this investment to the maximum health impact, and show them that the leading causes of morbidity and mortality, the 10 leading causes could be handled at the village level if they just had a few pieces of information. And therefore, the investment in the tools that would give them that information would actually have a big impact on health. And when they refused that proposition and decided, no, we just want to make a really fancy looking hospital, we fired them and walked out. We turned that one away and said, then we won't have any part of this because you will fail and you will waste a lot of money in the process, and people will be sick and die because you didn't do a wise investment.
You really just you just walked away from it, Dave, and basically saved money, but also it was saving energy and time, and that's so crucial.
Yeah.
Let me ask one last question to kind of close things out for today. We have covered a lot of ground today. We didn't get to every single question that I was wondering about, but I want you, if you would please, to sort of close it out here with what your kind of take-home messages from what we've talked about today. What are the 3 key points that you think emerging leaders particularly need to take away from the things that we've talked about today to sum things up? Dave, could you go there?
Yeah, sure. Well, first, of course, again, being really clear about the context in which you work. And unfortunately, in public health land, being government, it means progress comes slowly, sometimes painfully slowly. But I would urge people to lean into those challenges and just don't let the turkeys get you down. In fact, you can make progress. And we have to understand we're in kind of this step function. And we at times get a burst of funding, we get to make some progress, go forward, and then we're kind of stuck for a while. And then we get another investment, we get to make another step up. So that to me is being clear about my context and therefore all the people I work with. Another, of course, is what I said about herd animals. This is really worth studying, I think, for people to really appreciate. If you've never spent any time out on the farm or the ranch, get around some herd animals and watch how it works, because largely humans are like that. Probably 95% of us are herd animals, and maybe 5% are what we would call entrepreneurs. They're the ones who don't care what other people think. They're just going to go do what they think is the best thing to do. But that's not the way the mass of humanity works. And if you're going to work with the mass of humanity, as we do in governmental public health, you have to know how to influence lots of people. And then I guess the last point I'd make is that as a leader, actually think about some sales training. It can be very helpful. Knowing how to sell is an essential skill. Knowing how to influence your legislature to invest in a new public health program, knowing how to sell your colleagues on taking a step forward, maybe might seem a little risky if other people haven't done it. So knowing how to do that, but to do that means you've got to remain humble. You've got to know who you're working with, your customers, your colleagues, and all of those are essential attributes for a leader. Elon Musk, for example, he's the entrepreneur. I'm going to do what I think is right guy. I'm not going to sell it because I'm just going to do it and invent it and make it happen. That's great. If you can do that and succeed, that's wonderful. But in our context, that will just put you out on the edge. It will alienate you. You need to be able to draw the whole group towards your new steps, your new direction. And that takes dialogue, something you know a lot about, something you've studied. It takes learning how to build a coalition of the willing. That's sort of, it boils down to that for me.
Dave, thank you so much for this rich conversation that we've had today. It was, for me, heartwarming, illuminating, and I know for all those that listen to this conversation we'll be putting up online, they will benefit a lot. So thank you so much for taking time to talk to me today, Dave.
I really enjoyed it, Ed. Thanks much for asking.